I think we have to be at the table. All players have to get there, whether it's in healthcare, it's in education or energy, communications, those type of things. All of the stakeholders have to come to the table and say, where do we go from here? The old systems that got us to this point are no longer going to carry us forward. They're becoming fast obsolete. And so we need to sit down, figure out what's the next steps, what are we willing to do, and find a way to help pay for those things and then implement them.
But that requires someone to be at the table with you.
Right.
That doesn't mean that they have to send a representative.
Right. Exactly.
They have to send a deputy, that they have to send a commissioner. That, you know, as Harry Truman said, the buck stops here. Well, it stops in the governor's office, and the governor has to be willing to sit down with the parties and also not be inflexible. Right. As inflexible as no new taxes, as ludicrous as that is in this day and age. What happens? New fees, new assessments, new whatever you call them. People are paying them, and they just are hiding under the guise that they're not taxes per se. Right. Fallacious reasoning, spurious reasoning, and really disingenuous reasoning.
Absolutely, and that's why
mark those 3 words down.
Spurious. A new governor is definitely called for, and someone from the Democratic side of the aisle, I think, is where we want to have them come from, because I believe that, you know, all the candidates that we have running for governor this year are good people, and they understand it, they get it, they know that it's not just one or the other. It's a combination of factors. We can't just cut our way out of this problem. We have to grow revenue as well.
And they haven't cut each other up. No. They have each run on their own merits without attacking their opponents, as opposed to what is now happening in the Republican Party, where the 2 leading opponents have started to go after each other's throats this week.
And in both cases, they're further to the right of our current governor, and I don't think that's the direction the state needs to go right now. I think we need to come back to the center, and you know, there's reasonable people can see that there's value in these things and are willing to put their money on the table if they see the value. But at this point, they haven't seen that, and that's part of that lack of leadership at the governor's office. So I'm looking forward to this convention, because I think it's going to be an interesting election season, and whoever comes out of it at the end, because I know some of these folks are going to go to the primary, we're going to have a good candidate. It'll be a good season. I fully expect that Minnesota is going to elect a Democrat.
And the party will unite behind that person.
Absolutely. Yeah. Absolutely. Because you got to have leadership and teamwork. You know, you got to work together. You can't go it alone.
It's early for endorsements, but have you gotten any endorsements yet of people who have endorsed you in the past?
Not yet, not yet. So, well, I guess MAPE, that group did some early endorsements, but really haven't been pursuing
because it really is quite a bit before.
Yeah, this is more for the governor's race right now, and we'll get into those things in the next few months. Now,
you've had some interesting columns in the Star Tribune over the last couple of months, and one was talking about nursing level staffs, inadequacy of nursing level staffs. Let's talk about that. I mean, you have not been one who has been sitting on the sidelines. You've been out there, and you've been making your positions known, and that was one. I think it was a counterpoint to somebody else's column.
Well, there was a story that was released by the Star Tribune about some of the conditions and some of the injuries that are resulting in sometimes even death in our nursing homes, and we wanted to make sure that we know there's a linkage between the quality of the staff and the amount of staff for these nursing homes and the amount of funding that they're getting and their ability to bring in dollars. And we've been kind of behind the ball on this one. Each year that's gone by since I've been at the legislature, so I said we'll get to that next year. And we see these problems starting to arise, and they're compounding, and that's not right. We need to find a way to deal with this.
You can't have one nurse or one practical nurse responsible for 10 or 12 rooms. Right. And yes, patients do fall out of beds.
Absolutely.
And you can't really blame, in most cases, the hospital. you can blame the fact that they don't have the money for staff, or that the facility doesn't lend itself. I know my father, before he died, suffered from Parkinson's disease. Okay. He was very lucky to be on an experimental drug in a federal hospital. And one of the unique things about it is that the nurses' station was centered around a circle of rooms, so that there were 8 or 10 rooms. And that nurse could see into, they could do more with less nurses. But we don't have that. Our hospitals have been standing for a long time. And several of our hospitals are really on the verge of going under bankruptcy. So we have to do something about the healthcare crisis, and we can't just blame the hospitals. We have to look at the whole picture.
Absolutely. You know, the nurses in general are facing that same issue right now too, as we're seeing cutbacks, and they're being asked to do much more. We know that most of the healing that happens in hospitals and the care comes from the nurses, and so we definitely need to support them in any way we can. You know, and right now, especially in the healthcare industry, a lot of it it's about money, but it's being that the money's being directed in the wrong places. When you see a United Health showing these monster profits once again, and yet we're finding ways to have to cut back on the nursing staffs, or we'll say the most we can pay you if you're a nursing home staff person is $10 or $12 an hour. Who are you going to find for that kind of money to do the kind of work that needs to be done?
You don't get quality work. You don't get quality training for the work that they do, and the rest of the world laughs at us because we are still the only, quote, industrialized, end quote, country that has a for-profit insurance company health system. You would think that that would be heard more in arguments, and you would think that that would appeal to people more, to their sensibilities. Why is it that we have these problems? Why is it that we are the only country that faces this system? Yeah, and you hear, well, there are long delays in Canada and this and that, but if you speak to the people that live there, you find out that the long delays or the delays are not for emergency treatment, and that the quality of their health care is much better than ours. Certainly the death rate among newborns is much lower than ours.
The statistics don't bear out, and I saw something recently where, you know, our per capita rate is over $7,000 per year in healthcare costs. The next closest is in the $4,000 range, and in most of the industrialized nations are below, you know, $4,000 per capita. Yet their access, their visits per year are twice what Americans are,
and they're healthier.
They're healthier, and you know, there's a mismatch. We don't have the value there. It's much like I've said this before, but if you had an airplane where every week that airplane crashed and everybody died, everyone would be up in arms. We would demand results from that industry, and yet the similar things are happening with our healthcare industry. With the amount of money we pay, we're not getting the value, and people are dying because of it. And yet we're kind of, you know, silent about it. Or if we do something, if the federal government does something, and there's certainly problems with that bill, but there's a lot of good things in it. People get up in arms and say we shouldn't have done that. They jammed it down our throats, and there was no bipartisanship on it. And yet there was an opportunity for the other side to come to the table, and yet those that had the opportunity chose not to do anything.
Just say no.
Yeah, they
no
chose
matter
not
what
to.
It is.
It wasn't about policy, it was about politics, and that's what's hurting us at this time, is that we have to move forward with getting things done. We don't have time to waste on politics anymore. I
say to my Republican friends, and I do have Republican friends, they are becoming a diminishing group, and a lot of people are being driven out of the Republican Party. Get over it. He's the president, and he's going to be the president. Let's think about the people. But they don't think about the people. They think about the party. They think about re-election. And it's a shameful situation. We have a healthcare company that just made $3.9 billion profit in the first quarter. Not patients, not care of patients, not research and development, but into the hands of stockholders. Shouldn't be. Just yesterday, they issued a Reuters expose of WellPoint,
right,
which apparently had a computer system so that when a woman was diagnosed with breast cancer, they could find ways to drop her from coverage.
Yeah.
This is criminal. This is outrageous. This is something that should never happen in a healthcare system.
Absolutely. And that's one of the things that the healthcare reform bill is going to stop happening. You know, denial of care, having pre-existing conditions, rescissions. That's what they were doing there, is rescinding their policies. There's a lot of good things that are in this bill, and there's a lot of work still to be done. Unfortunately, they're saying we can't do a lot of it until 2017. But I think there's a lot of things that we can still do at the state level to continue to improve the quality of care.
We can build a framework, is what we can do.
Yeah, we're working on that. So.
Now, in the little bit of time we have left, what about drug reform, prescription drug reform? I know you've been active in that, and you had a column in the Star Tribune recently about that.
Right. Well, thank you again for mentioning that. I'm working on a number of pharmaceutical issues, as I mentioned, the Take Back program. I'm also working with a group that's a coalition here that's of health plans and labor and the hospitals and consumer groups to say, you know, including AARP, that, you know, we got to find a way to bring our costs down. And it's one thing to say, you know, we'll have insurance companies deal with this. It's another thing to see if we can drill in. And one of the things that I'm working on is the practice of how they market their drugs, and that they are able to get information on prescribing habits of doctors. When you go in to see your doctor and he fills out a prescription, that information is going right back to the pharmaceutical companies, to the reps, to know how much that doctor is prescribing of a particular drug, if he's doing it or her. They're doing a certain level each week, or if their levels are going up and down, whether they need to be paid another visit, whether they need a few more free samples, things like that, to continue to keep them writing the prescriptions. And we feel that's a particular practice that we need to stop.
It's bribery, is what it is.
It's very subtle, but it's certainly, it doesn't seem right. You know,
I've never been called subtle.
But you know, a way of doing it. But we can do this with academic detailing, where we give, you know, the hospital or the doctors the academics behind it, the research. They don't need to be catered to with a number of visits, developing, say, we're going to take you to a trip out to Hawaii and show you the grounds out there, and you'll speak for half an hour, but we'll give you a whole week out there, and as long as you continue to
and
write
a
our
stipend
prescriptions,
in addition,
our prescriptions, and we'll continue to be friends. And those kind of things, though doctors say that they're not influenced by that. We're all human beings, you know, and we're influenced by the relationships we have.
Well, most of us are human beings. There are a few I could name who I don't think fit that category. We've been talking with Senator John Dahl, the 40th Senate District, on his way to Duluth for a party convention, and come back soon and talk to us, especially after the convention. Always a pleasure.
Yes, thank you very much.